So what is a good way to get off statins such as Crestor, Lipitor as an example? See, statins are commonly prescribed to actually lower cholesterol levels and reduce the risk of heart disease, but not entirely 100% true. See, I think it's more of a money-grabbing drug. Some people may wish to actually explore alternative options or make lifestyle changes to manage their cholesterol without relying on medication. So that said, I will share with you some key points to consider when thinking about getting off statin pills. In addition, I will list some references within my video description, as some of the supplements I mentioned, they have multiple evidence behind them. So number one, check your inflammatory markers. See, certain blood tests can actually help predict your risk of heart disease. These include hsCRP, which is high sensitivity C-reactive protein. This protein is actually produced by the liver in response to inflammation, and high levels of hsCRP have been actually associated with an increased risk of heart disease. And a study found that a 1 milligram per liter reduction in hsCRP was associated with 19% lower risk of cardiovascular events. Homocysteine, this amino acid is actually produced by the body, and it can damage blood vessels when levels are very high. Higher homocysteine levels have been actually linked to an increased risk of heart disease and stroke. HbA1c, now this test measures your average blood sugar levels over the past 3 months, and high HbA1c levels indicate poor blood sugar control and have been associated with an increased risk of heart disease, especially in people with diabetes. LP small a stands for lipoprotein small a, or LPPLA2. These are specialized lipoproteins that can contribute to the development of atherosclerosis, meaning hardening of the arteries. So when levels are elevated, they actually start to cause restrictions in the arterial system. MPO, myeloperoxidase. Now this enzyme is released by white blood cells during inflammation and has been linked to an increased risk of heart disease. So these inflammatory factors are much stronger than worrying about your cholesterol numbers. 2. Monitor your red blood cell magnesium levels. Magnesium is an essential mineral that plays a crucial role in heart health, and low magnesium levels have been actually associated with an increased risk of cardiovascular disease. Now, your doctor can actually order a red blood cell magnesium test to assess your magnesium status and make sure it's not serum levels. Number 3, remember that statins only lower cholesterol. While statins are effective at reducing LDL cholesterol levels, they don't address other risk factors for heart health, such as inflammation, oxidative stress, and blood clotting. It is important to take a holistic approach to heart health that goes beyond just lowering cholesterol numbers. 4, focus on lifestyle changes. Making sustainable lifestyle changes can actually have a powerful impact on your heart health. Some key areas to focus on include eating a heart healthy diet, emphasize whole, unprocessed foods like a grass-fed, grass-finished beef, free-range eggs, seasonal fruits, very small amount of vegetables, and quite a bit of healthy fats. Limit your intake of added sugars, trans fats, and heavily processed. 5, prevent LDL oxidation, as LDL cholesterol is particularly harmful for the arteries and can contribute to the development of atherosclerosis. Some nutrients and supplements may help prevent LDL from oxidizing, such as vitamin E complex. Now this group of fat-soluble antioxidant helps protect LDL oxidation. Good sources would be sprouted nuts and some seeds and some avocados. Nitrate supplements from dietary sources like arugula can help to improve blood flow and reduce oxidative stress and prevent heart attacks and strokes. So my final thoughts, getting off statin pills is a decision that requires careful consideration and of course collaboration with your healthcare provider, because you have to do multiple blood tests and see what level you're at. But by focusing on reducing inflammation, optimizing your magnesium levels, and making heart healthy lifestyle changes and preventing LDL oxidation, you will be able to manage your cholesterol and reduce your risk of heart disease without actually relying on medications. Now, in addition, if you don't like the medications, look into niacin and red yeast rice, as I've created numerous ebooks that talks about a non-statin treatment. So, as mentioned, make sure you check your hsCRP, your homocysteine levels, your HbA1c, your Lp(a), Lp(a)2, and your MPO levels to kind of assess where you're at with your cholesterol. And one of the most crucial thing to include in your diet is polyphenols. Look into getting at least 2,000 milligrams of polyphenols daily, as it will prevent oxidation of your LDL, which is known for what is called apolipoprotein B, or short for ApoB.